Hello ladies and gentlemen, my name is Emem Archibong. I'm a singer-songwriter and I'm also a pharmacist. In today's video, I'll be talking about traction alopecia. I'm going to talk about how to prevent it and things you can do in order to prevent its progress and also ways to treat it if it's already happened to you. If you'd like to find out more, please feel free to watch on. Before I go any further, I'd like to ask you to please like, comment, subscribe and share this video with your family and friends if you find its content useful, and don't forget to hit that notification bell so that you'll be updated every time I share a new video. Without any further ado, let's get into the video. So what is alopecia? Alopecia is basically hair loss. It can affect just the scalp or the entire body. It can be due to heredity, hormonal changes, medical conditions, tight hairstyles, or it can be a normal part of aging. It is more common in men, so that's alopecia. Traction alopecia, however, is very preventable. Traction alopecia is hair loss that's caused by repeated pulling on your hair. For example, tight ponytails, buns, braids, chemicals or heat on the hair. All of this can cause the hair to start, shedding at the edges because you're pulling it from the root. The reason I've decided to do a video like this is because I'm obviously black and I braid my hair, and I really am very mindful of the fact that if I braid my hair too tightly, I can lose my edges, and it's something that a lot of women suffer from, especially black women, because of our hair care practices, which is actually a necessity because our hair tends to be very coarse and really not very manageable. I'm not speaking for everyone. I know my hair is not very manageable in its natural state, so I have to do things in order to make it manageable for everyday life. Traction alopecia is preventable. All you have to do is stop doing the hair care practices that are causing it. I know sometimes this is easier said than done. Traction alopecia, while it is reversible, can also cause permanent hair loss if the styles or the reason that it's happening is not being addressed. Signs of traction alopecia are: 1, a receding hairline, typically around the forehead, the temples, or the nape at the back of the head. Number 2, small pimples appear on the scalp or at the base of braids. Number 3 sign of traction alopecia is redness, itching, and ulcers on the scalp. Number 4 sign of traction alopecia is the hair parting widens, so the hair parting becomes wider. Number 5 sign of traction alopecia is that you get patches of thin or broken hair in places where the hair has been under strain. And the 6th sign of traction alopecia is patches of shiny, scarred skin in more advanced cases. So it is really important to keep yourself presentable as a woman, as a black woman. And so that means maybe wearing weaves, wearing braids, even wearing your natural hair in cornrows, just to kind of make it manageable. But the problem is if those hairstyles are too tight, then you could lose the edges of your hair or even a lot of your hair. And other things that can actually cause traction alopecia include chemicals, so maybe dyeing your hair or using relaxers, which are chemicals used to straighten curly hair. There are various causes of traction alopecia, and they include certain hairstyles like dreadlocks, braids, cornrows, tight ponytails. Also, hair extensions or weaves can cause traction alopecia, and like I mentioned, hair relaxers and chemical treatments. Headwear, hair accessories, very long hair, using extensions and relaxers together can also increase the likelihood of getting traction alopecia. It tends to be common in people that tie their hair back into very tight ponytails, for example, ballet dancers or certain sports women. And also in people that have hair practices that include tightening the hair and pulling the hair from the scalp, such as braids and dreadlocks. And this these tend to be women of Black African origin, or maybe Black American. Now I'll go into the treatment. So the treatment of traction alopecia, the main treatment is prevention. So the moment you realize that you're losing your edges or you're losing any part of your hair, the best thing to do is to remove what's causing it. So the treatment for traction alopecia include avoiding tight hairstyles if possible, avoiding or limiting chemicals including relaxers or hair dyes, changing hairstyles every few weeks, trying hair growth products, e.g. minoxidil, using anti-inflammatories, e.g. steroid creams, which will reduce swelling, and in severe cases, you may have to have a hair transplant, or camouflage techniques are also an option. I hope you found this video useful. Emem, the singing pharmacist, signing out. Please don't forget to like, comment, and subscribe. And don't forget to have a good day. God bless. Bye.